we have seen a sharp decline in COVID-related sales, both in pharma and in diagnostics. The good news is the strong and robust growth of our underlying business, our newer medicines and our diagnostics solutions. So overall, a very robust result. And on that basis, we could also confirm the outlook for the full year.
The comparisons on COVID-related product sales were going to be tough. Have you had peak sales now, do you think, for this particular product area?
Yes, indeed. We do already see a sharp decline in the third quarter. We expect that to continue for the remainder of the year. And we also believe that the demand for COVID will be not as strong next year. Of course, you can never predict how this virus develops, but in our base assumptions, we expect that now we will have lower levels of COVID-related sales.
Severin, how quickly can you ramp up, if necessary, though, when it comes to those COVID tests, if we do have a situation that emerges in Europe and beyond?
The situation today is really completely different to what it has been at the beginning of 2020. In the meantime, the industry as a whole, and certainly our company, Roche, has much, much bigger capacities. So we are able now to ramp up quickly if demand should indeed come back.
Severin, I was commenting earlier on your ophthalmology portfolio that there have been great strides when it comes to eye vision loss, that you've come up with key products here. Just tell us how advanced some of these products are and what your hopes are for this particular part of the portfolio.
Yeah, indeed. We have launched really a very important medicine called Vabysmo at the beginning of this year in the US. We have had a stellar launch of this medicine, which helps to treat severe eye diseases. And the good news is that medicine is now also approved in the European Union, and we can continue to bring this important medicine to patients all over the world.
Severin, good morning to you. And what has COVID done to how you develop new medicines? Of course, we've talked a lot about mRNA and different techniques and the speed with which, the extraordinary speed with which the vaccines got to market. How has COVID changed the world for all the other important drugs out there that we've talked so many times about?
What we have seen in particular is a completely different level of collaboration between the industry and regulatory authorities. To give you one example, we have adopted rolling submissions. So unlike in the past, where we did all our analysis, we collected all the data and then submitted the file for approval, today, we continuously deliver data to the authorities, and as a result, the approval can be accelerated. So I do hope that based on those experiences which we made with COVID-related medicine, we can adopt those learnings also for other severe diseases, and as a result, accelerate the approval of future innovative medicines.
Yeah, and is it still the same medicines needed for the same Western illnesses, Severin? Are we making big progress on heart disease, on oncology, all these areas where, quite frankly, they're the biggest killers on the planet?
Yes, and we should not forget that even during the pandemic, more people were dying from cancer and heart diseases than from COVID. So it was extremely important to come up with solutions for the COVID pandemic. But as you point out, there are important other severe diseases we have to keep fighting against, and that's what we do.
Severin, can I ask you about what do you think the impact of the economic slowdown and potential recession is going to mean for demand for your drugs here? In a perfect world, there shouldn't be a correlation, but clearly there is, as healthcare systems are struggling perhaps to meet their own financial requirements.
Yeah, indeed, of course, the geopolitical tensions, inflation, etc., has a huge impact on the development of overall economies around the world. But as the experience has shown in the past, our industry, the life science industry, is actually less exposed to economic cycles. The demand for life-saving medicines for severe diseases like cancer is typically less dependent on economic cycles. I think what really matters in the long term is your ability to innovate, your ability to come up with new, better medicines. And from that perspective, as far as Roche is concerned, I'm very confident. We are at a record high with 85 new medicines in our overall portfolio, and that should provide us with growth, not only for now, but also for the mid and the long term.
And on the back of COVID-19, there were big hopes that we may be witnessing an industry shake-up that was long-lasting when it comes to the amount of funding coming in for research, the speed with which regulators would approve new drugs. How much of this has actually been lasting now as we fast forward to 2022?
Yeah, as I pointed out, the collaboration with regulatory authorities clearly has improved. I'd say the other element which will be of lasting impact is that acceleration of the digitalization which is happening in healthcare. And I believe that will help us to develop better medicines, to make healthcare delivery more efficient. And I also think that this digitalization, which is now happening in healthcare, finally, I should say, also happening in healthcare, will also help us to make the system more efficient.
Very nice to see you today, sir, and we'll have plenty more time to talk to you, hopefully, before you move up to that swanky chairman's office quite soon. Severin, nice to see you, sir, as ever. Thank you very much indeed.